Mm.
Hello, good evening and welcome to another Catherine McEwan Foundation book live event. We're delighted to be here tonight to talk about going back to school, and we have two special guests with us this evening to answer your questions. I think this week and the past couple of weeks have been an anxious time for many people returning to school after 5 months in lockdown, and we're very happy to welcome two guests with us to talk about this tonight. It's a Catherine McEwan Foundation Facebook first, as we have a patient with us tonight, and I'm delighted to welcome Amelia tonight. So Amelia, can I just ask you to introduce yourself, please?
Sure. I'm Amelia. I was diagnosed with ulcerative colitis when I was 10. I had surgery when I was 12 to remove my large intestine, and then I had the operation a year later for the reverse. So since then I've been living with a J-pouch, and I'm currently in 5th year doing hires this year.
Brilliant, Amelia, thank you very much, that's great. And our second guest is James from Southampton. James, I'll just let you introduce yourself, and then once you've done that, if you could just start off by giving us your presentation. During James's presentation, if you can just come in to us with your questions, and then we'll go into question and answer just after James has given his presentation. Thanks, James.
Thank you very much. So I'm James Ashton. I'm a doctor down in Southampton, and my background is I'm a researcher mainly within paediatric inflammatory bowel disease, but also during this, I guess the last 6 months or so, we've become increasingly interested alongside my boss, who's Professor Mark Beattie, in sort of the impact of COVID-19 on the gut, and we've looked at that reasonably extensively through a couple of different projects. And from that, we have also developed some sort of local guidance on returning to school, and also working through the British Society of Paediatric Gastroenterology. We've also sort of released that guidance a bit more widely. So I guess that's why I'm able to talk a little bit about it. So yeah, I can start the presentation, I think. Okay, so the first slide is just the title. I'm going to talk about two things mainly. So the first one is about the impact of COVID-19 on children, and that's sort of the impact, the acute impact, so how much it affects children and young people. And then the second thing is how it affects children with inflammatory bowel disease, and then how that impacts on children going to school. And so if we could have the next slide, that'd be great. So the first slide, so this is a graph, and it's a graph from a paper that was published in the British Medical Journal. So that's a really sort of well-renowned journal, and it looks at a lot of cases of COVID-19 in the United Kingdom. And what it shows is, so if you go from the top to the bottom, at the top you've got people who are aged, so the oldest in the population, so 90 or above 90, and at the bottom you've got the children, so you've got people who are aged 0 to 4, and then going up to teenagers as well. And you can see that the bars, the size of the bars, represent how many cases there are in total of COVID-19 in that age group. The blue bars represent how many people have died within that age group. And so you can fairly easily tell that it seems to be a disease that primarily affects older people. And if you come down to the children, so sort of, I guess 19 and below, to cover children and young people, there's really very, very few cases. There's a few more from the very young children, but that may just be reflecting testing a few more of those children at that time. And actually the outcomes are, they're basically all discharged from hospital if they were even hospitalized at all. So it seems to be a disease that affects older people. So that's the first thing that's sort of slightly reassuring for a younger age group. So if we could just have the next slide. So this one, I've just summarized 4 points about children and young people getting COVID. So overall, it appears that children, and that all the evidence would suggest that children are less likely to get COVID-19 than older age groups. And that means that although they can still acquire it, it's less probable that they will acquire it from someone who has the disease, whether that is a child or an adult. That's probably the baseline that we should be working from. If they do get it, children and young people, and this is, I guess, there is a spectrum of this. So if you're a very young child, it's very unlikely you're going to get severe disease. And if you're an older teenager, it is slightly more likely, but still very unlikely that you'll get severe disease if you catch it. And catching it is less likely than if you're an older adult. I think it's fair to say that children can pass COVID-19 on to others, but it does occur at a lower rate than in adults. So children, if they have the condition, they're likely to have less severe disease and are less likely to pass it on to someone else, which I think is very important when you think about schools, because obviously there's huge numbers of children in schools. And one of the biggest concerns is that if one case happens in a school, you might pass it around that school very quickly. And whilst we don't have much information from the UK on that, there are countries that kept their schools open throughout this pandemic, and the rates of transmission from child to child within the school was much, much lower than from adult to adult in workplaces, for example. However, I think we are at a stage where we don't know all the answers, and I think it's important to hold our hands up and say that. Whilst the rates of transmission in school are low, I think it's very sensible to take all necessary precautions. And certainly in Scotland, you guys are quite, well, trailblazers in terms of where you are in the UK. And we in England seem to borrow a lot of policies from you when it comes to schooling recently. And I think that's sensible. And I know that on Monday, schools are going to be mandated in secondary schools to wear masks in communal areas. And I think that's probably a good move, just because we don't have all the answers about what is safe and what is not. And so I think taking any precautions necessary is a good thing. So can I just have the next slide? So this is just my final slide before we go into the questions. So I thought I'd talk a little bit about the specific information available internationally, so from lots of different countries around the world, on the effect of COVID-19 in those children who have inflammatory bowel disease. So this is a big study that was led from the United States, but takes data from 33 different countries around the world. And they identified in all age groups, so from 0 to, I don't know how old the oldest patient was, probably about 90, 525 cases worldwide. And this is slightly out of date now, so it was published maybe 6 weeks ago, maybe up to 8 weeks ago. But at the time, these are the young age groups that they looked at. So 0 to 9 years, 10 to 19 years, and then I've also included the slightly older age groups, so young adults. And you can see that out of the 525 cases, in this table, if we just look right on the left-hand side, the top two age groups are the 0 to 9 years and the 10 to 19 years, so covering all children. The total number of cases in that youngest age group is 11, very, very small numbers. The total cases in the next age group is 155, which again is low numbers. The vast majority of all of those cases are treated as an outpatient, so they don't even need to go to hospital, or at least when they went to hospital, they were discharged straight away. And none of those cases worldwide, so these are all children with inflammatory bowel disease or young people with inflammatory bowel disease, none of them died. One required admission to intensive care, and it's unknown about whether they had additional problems, medical problems. So these data really show that whilst there is obviously a lot of concern, the data would seem to point to it not being a big issue in children with inflammatory bowel disease, COVID not being a big issue. However, I'd like to say also that we don't all have the answers. We don't have all the answers for this. And so whilst this is initially reassuring, I think any precautions necessary are sensible. So I think that's the end of everything I want to say from that.
Brilliant. Thank you very much, James. That's a very helpful overview, and I think it's always great to be brought up to date, because this field seems to change by the day and sometimes by the hour, and so does policy around it. So it's always it's hard to keep up. Amelia, you've obviously been back at school for a couple of weeks now. What is the feeling in secondary schools about coronavirus? Are lots of people worried, or are they quite relaxed about it? Or how's the general feel been in your school?
I feel like it's a bit different in sort of all your classes. Some teachers sort of make a big deal about wearing a mask and safety and everything, and then some classes it's just like nothing's really changed. So it can be quite stressful sometimes. Like at lunch, they make everyone wait outside for the other years to come in for their lunch. But when you're waiting outside, you're in like a big huddle of about 300-400 people. So looking about there, it's quite stressful, because you just think like if anyone did have coronavirus, it'd be quite easy to spread it, especially in such large numbers.
So I guess that's maybe part of the reason why the Scottish Government have changed their advice, and from Monday everybody in that type of area will now be advised to wear a face mask. So it sounds like you think that's probably quite a sensible thing to do, and I think it will be interesting to see how many children actually take that up, but I think most of them will. It's important to say face masks aren't the only thing that you have to do. Obviously, hand hygiene and social distancing are important too. James, we have a interesting question here, controversial maybe actually, from Bernice Figga. So Bernice, thank you very much for asking us a question. Why does Dr. John Campbell show that children are the drivers of the virus? Most are asymptomatic but transmit to everyone. They have much higher viral loads and in some cases equal to adults. He has the scientific evidence and data to prove it. So I guess just while we were thinking about an answer to that, we can say that in Scotland this week, the number of children that have been tested has gone up 8 times higher than it has before, with children returning to school. And of those children tested, only 3 in 1,000 are showing positive tests. So the number of children carrying the virus just now in Scotland is very, very low. So perhaps that gives you some context to answer it. James, what do you think?
Yeah, so I think that, as I said, it's very important to acknowledge that we don't know everything about this. And I think it's not that we don't, it's not that lots of studies haven't been done, but some of the information, such as transmission in schools, especially within the UK, there just hasn't been an opportunity to get those data yet. And I think that in terms of answering about specific studies, so there was, I don't know if it's the study that you're referring to, but there was a study published last week which was looking at the viral load. So that's the amount of, I guess, copies of the virus that are in the nasopharynx, so in the sort of nose and mouth of children. And they compared that to the amount of virus or copies of the virus that were in the secretions from adult patients who were in intensive care, so similar sort of areas of the body. And they concluded that the numbers of there were higher numbers of virus in the children. And I think there were a few issues with that study. One was that they didn't compare the viral load on the same days. So in children, they looked at it on the second day, I believe. Or no, maybe the 7th day, and in adults they looked at it on the 2nd day. And actually, over time, we know that the viral load will change hugely, and so it's not necessarily a comparable thing. However, I fully hold my hands up and say, I think we should be being cautious to a certain extent, and I think taking some of the factors into account, like Richard has been discussing, so wearing a mask, good hand hygiene, social distancing, should mitigate against a lot of the transmission anyway. And I think it's very important to take these studies in the context of the literature that is there. So all the studies that have been done, because there's a lot of evidence to suggest that transmission in children is low. In fact, that's the most replicated finding across the studies that have been done at the moment.
Good point. Thank you. Very, very good answer. What do the two of you think about the Scottish Government saying everybody has to wear face masks? Do you think that's a sensible thing, or do you think it's a political thing? So, Amelia, what do you think first? Do you feel all right about wearing a face mask, or do you think it's overkill?
I mean, I think it does make sense if you're having to wear a mask, like in shops and things like that, where even in little shops where you might pass maybe two people. So then to not wear them in a school that might have like 2,000 people in it, it doesn't seem to make sense. So I think we should.
Yeah. Okay. James, what do you think? So it's in England, it's a slightly different picture, isn't it? So people are only having to wear them in areas where there's high amounts of the virus.
Yeah. So I think as with a few things recently to do with schools especially, we're lagging a bit behind in England. And none of our schools have gone back yet, is the first thing. We're all still on summer holidays. So when they go back, that they're going to make masks in areas that are considered to be higher risk. So exactly the same as you've got in Scotland, we should all be wearing them they're mandated to be worn in shops and other communal areas like cinemas and things like that. They're not mandated to be worn in restaurants and pubs, I guess because you need to eat and drink. But I mean, in reality, there's a lot of time where you're spending more time in a restaurant and a pub than in a shop. So I think that there is some mixed messages, and I think you can't necessarily take away how political this might be. However, I can't see the downside of wearing a mask in this context, because it reduces the viral transmission if you have the disease and you don't know about it yet. It reduces your likelihood of catching it if there's someone else with the virus around. And so whilst it's difficult to mandate these things and make people do them, and a lot of times people don't like being told that they have to do something, if we're going to have, and I think getting children back to school is absolutely vital, if we're going to do that, I can't see the negatives of pushing people towards wearing masks in order to keep schools open and keep children safe. I think that's important.
Yeah, I agree. I think it's a good and a sensible idea, and I think the science behind it is good. So the World Health Organization, for people who don't know, suggested on last Friday that in areas where people could not socially distance, they should wear masks, and that includes schools. So I think it seems a very sensible way forward. Amelia, how did you get on with your exams? So obviously there weren't exams this year, but you were still offered awards. How did you get on?
I think that it went quite well, the SQA. Obviously there was a bit of a situation with sort of people getting maybe misgraded, like them putting down results. One of my results got put down, but I wasn't aware of it, and then we just got given a letter in school telling us our sort of right results. But it was quite strange waiting on results day and getting a letter for the door telling me the results from the exams didn't really sit.
And do you, because of your colitis, do you think you felt any different about going to school? Do you feel any different to the other children in terms of precautions that you're taking or other things?
I feel like it is maybe a bit more stressful for the fact that I've been in my own house for sort of 5 months, so I've just sort of gotten used to I need the toilet, I can go to the toilet, I need to take any medication, I can do it, sort of just doing everything at my own pace, to then sort of going back to school where everything's really structured for the whole day.
So you found it better or worse?
I think it's worse going back this time, just to all the time we've had off. I think it just made it a bit weirder.
Yeah, I think everybody would feel the same way because it's been such a long time, 5 months. I think if we were off our jobs, me and James, for 5 months, we would feel anxious about going back too. But I hope things are settling down for you now. James, we have a question from Shona Johnson. Shona, thanks for your question. Everybody else, keep your questions coming. I've been trying to get a home test kit, but it's been really difficult. So because of all the children requesting kits, James, this week in Scotland, there have been some shortages. My daughter's on day 5 of symptoms. Does this mean we should self-isolate for the 14 days, as tests should be done within the first 5 days?
So I think, the guidance is to self-isolate. Now, I think if you were to have a test and that were to be negative after the 5 days, I'm not sure what the local guidance is in Scotland for whether you need to continue to self-isolate. I believe that you probably would. Sorry, Richard, did you want to?
So I was going to say, once you have the test result, then you can seek further advice. Some of it will depend if you still have symptoms, and it will also depend on, if other people in the household have symptoms too. So I think there genuinely have been shortages this week, and the turnaround time for tests, which was 1 day, a few weeks ago, has now gone up to 4 and 5 days. So I think until you have a result, and if your child still remains unwell, then you should continue to isolate as a family.
So I think that just building on that slightly, when you get the test result, it gives you very specific advice about if you've got continued symptoms, including a temperature, you need to continue to isolate. And so if your test result is negative, but you continue to have a temperature, because there is this possibility that there may be a false negative, they can recommend you continue to isolate. But I think, you can't make that decision necessarily until you've got that result, and then there'll be some extra advice that you can get probably from a government website. Yeah,
or 111 if you need it. So seek advice. I hope you're able to get a test kit soon. We have a question and I think a point from Dorothy Brodie. So I'll ask this question to you both. It's quite a long question, so bear with me. Hi there, I've returned to school as a pupil support worker and currently having a battle with our department head about children's toilets. They do not have lids on them and they are a shared facility. I'm asking for lids to be out on toilet pans, but being told it is not necessary. Also, the disabled toilet and children's toilets in our department are not ventilated, which is a worry to me. I have an ileostomy and I'm been complaining about the toilet use, which has windows, which I'm happy with. What are the thoughts on ventilation in toilets and toilet lids? I guess, Amelia, are there worries about the toilets in particular at school from your point of view as a patient with IBD?
Well, even sort of before everything with coronavirus, like the disabled toilets in the school, they're either always locked, so you can get the radar key, I think it is, but we got 2 different types of radar keys and neither of them worked for the disabled toilets in our school. And like, if you do need to toilet, every toilet is locked.
James? James, do you have any thoughts about that question, just on ventilation and toilets in general? I suppose we've talked on previous Catherine McEwan live sessions just about access to toilets and toilets in general for patients with IBD, but I suppose particularly in the context of the risk of coronavirus for IBD patients, whether they have a stoma or just IBD without a stoma, what are your thoughts on that?
Yeah, so I think the first thing, as you said, is that it's absolutely vital that children and young people with IBD have access to a toilet at school that they can reliably get to and not have to worry about that, because that's a potential source of anxiety which can be completely avoidable. On the context or on the topic of the risks associated with lack of ventilation in toilets, and so probably this boils down to the risk of, one, whether you could catch the virus from feces, and 2, what sort of the cleaning protocols going and touching door handles, that sort of stuff when you go in and out of toilets. So on the first one of those, as far as I'm aware, in the literature, also in all the studies that have been done, there is one case where they've demonstrated that you could catch coronavirus or this coronavirus from someone's feces, because they've only got live virus once. I guess that shows that it's possible, but the context that was in an extremely unwell patient in intensive care. So beyond that, I think it's hard to get any judgment exactly about about whether you could or you couldn't. I think it's good to err on the side of caution again. In terms of cleaning protocols, I think you clearly got to have something that if you've got loads of people going in and out of a toilet, you've got to be able to clean the door handles. You've got to have good hand sanitizer in and out, so you can make it safe for people to do that. And if, to answer sort of the question directly, I think that if that's not in place, then that needs to be discussed within that school, because it's not just for children with inflammatory bowel disease, but for any child, it's important to be able to go to the toilet and feel that you're not going to be putting yourself at risk. And I think especially for children with inflammatory bowel disease, having access probably, as Amelia was saying, to a toilet that you can get to with a radar key would be key, so to speak.
No pun intended.
Yeah, and if that's not possible, then that definitely needs to be adjusted in that school.
Yeah. So Shona, I think the overall message is, although ventilation is one part of it, cleanliness is probably a bigger consideration, and good cleanliness between different users would be very important. I think in terms of lids on the toilet, I think cleanliness would be the biggest issue. So we can help support you if you think things are not in place for that. Next question, I think for you, James, and then I'm going to ask you something else, Amelia. So what about the situation for children going back to school whose parents are at high risk? So parents who are shielding or have been shielding previously. So Bernice Figa has asked us again about her husband who has high risk because he's got kidney disease and got diabetes and was shielding, and they're worried about their 10-year-old son going back to school and then bringing something back to him. So what advice or what do you think about that?
So it's a really good and difficult question to answer. Shielding has now been removed. So there is the concept of shielding, which was up until I think the start of this month in England. I don't know if it's the same in Scotland.
Same.
Nobody now needs to shield, and I think that's problematic to say that for certain reasons, because obviously there are local outbreaks, and then what do you do in that scenario? But taking your question more directly, the risk is very, very low. I would say the risk is very low. If you had a child or a young person who was shielding previously with inflammatory bowel disease, so that was for a very specific number of reasons, then we would recommend, or the national recommendations would be for that child to go back to school. And if we can recommend for that child to go back to school because we think it's safe, then I think that it would be safe for a child of somebody who's shielding to go back. However, there must be some caveats, and I think the first caveat is that school must be able to demonstrate that they have a very stringent policy for social distancing, mask wearing from next week is going to be present, and that there's good hand hygiene and things like that, so that the risk can be mitigated, although the risk is very small. I think the second one is that for a specific sort of range of conditions, the risk it remains quite high. So in children, for example, there is still some concern about children with some different types of cancer, blood cancers, and those children are still deemed at a high enough risk that they may not need to go back to school, depending on sort of the discussion with the doctor who's treating them. And that's the same sort of thing for children with inflammatory bowel disease. So whilst we would recommend everyone could go back to school, it's probably going to be a case or like a patient by patient discussion to determine what the situation is. And I think that although I don't know whether this would be the case, I think there has to be a degree of leniency. So I think there has to be an element of treating everyone individually if there is a huge amount of anxiety, or if there's people at home who are hugely vulnerable, about how we deal with those cases. Because it's very easy for us to say everyone should go back to school. However, a month ago, we were saying that people had to stay in their house and maintain as much safe as possible. And I think that's a huge jump for people to make. And I think it's not fair to say that we should immediately be broad brush telling everyone to go back to school without having a discussion for specific people. And in some cases, it may be better to put in extra measures to mitigate those risks. So I've sort of tried to haven't managed to answer your question specifically, but I think it's very difficult without knowing a specific case to do that. And in those situations, it should be a case by case discussion to reassure and mitigate risk.
Yeah, I mean, I think these are difficult questions, and I think we're faced with them all the time. And I think some of the difficulties come from we don't know precise answers. We can give you our best advice based on what science tells us. I think there are, common sense and practical decisions to be taken at every stage. So we would know 10-year-olds are at low risk, and with appropriate precautions, they can go to school, take those precautions in and out of school, and to keep a 10-year-old off school for a very long time also has negative effects. So it's careful considerations, no easy answers, but in general the risk in that situation is going to be low. What everybody wants us to say is, this is a no risk situation, or this is perfectly safe. I'm afraid that's not real life. And there have been lots of difficult decisions already, and there will continue to be those. But in general, the advice would be, it would be okay for your 10-year-old to go to school. The balance of benefits outweigh the risks taken with that situation, but you should still continue to take precautions. So I think we might turn just to something a bit lighter just now, just to keep the questions flowing. So Amelia, I think you were the recipient of the Catherine McEwan Foundation Scholarship Award. I wondered if you want to tell us a bit about that and what that means for somebody with IBD going to school.
Yeah, so obviously when I was unwell, I missed a lot of school. I think it was like over 2 years, obviously not all at the same time, but sort of over the course of everything. So when it comes to like learning new things, I find it okay, but it's just all the stuff I've missed. So anything that's sort of built up. But I think Saturday school was really helpful when it came to it, because like even just being retaught something in sort of a small environment as well than a classroom. So there'd only be like around 6 people in a Saturday school session. So it really was good like one-on-one learning. So if I needed help with something specific, it was really helpful. And as well for chemistry, at the start of the year in my chemistry class, I sat a test and I hadn't been very well towards the end of the year when I'd finished chemistry. So the first test I sat, I got 23%, which is not good. And then I went to Saturday school and one of them was for chemistry. And after I'd been to one session for Saturday school for chemistry, I asked to reset the test and I resat it and I got 70%. So like that's just a massive difference just from going to it once. So I think it is a massive help, and especially for someone who's like missed so much school, I just think it's a great idea like to give the scholarship to people.
It's great to hear that. So the scholarship has only just started, but the idea is to give children who've had difficult IBD and missed a lot of time from school, to give them extra help at Saturday school, as you say, in those smaller sessions. And already it's had a beneficial effect to you. So fantastic, well done. And I hope for the next school year it continues to give you a very positive benefit. So brilliant. Next question. This one's from Lucy Proctor. Lucy, thanks very much. She's asked, the school asked if my son needs to be 2 meters away due to the fact he's on azathioprine. And I've said, no, as he wears a mask in the corridor since he went back to school, he should be keeping 2 meters instead of 1 meter distance. What do you think of that, James?
So the evidence on that is, I'd say, poor. Whether you keep a meter from someone, 1.5 meters, 2 meters, lots of different European countries had very different strategies right from the start. So they gave maybe a 1 meter social distancing or 1.5 meter social distancing, and now obviously in parts of the UK we are a sort of a 1 meter plus social distancing. I don't think that there is I can't give you a scientific answer as to whether it's safe or not, and I would say that if you're doing it to mitigate the risk, including wearing a mask, 2 meters isn't always, I can understand why that wouldn't always be completely practical or even doable in certain parts of school if they have lots of children that they need to fit into a certain area. So the other thing to say about being on azathioprine is that, so when we did the original classification of risk, or it was done nationally, being on a stable azathioprine dose without active inflammatory bowel disease was considered to be moderate risk rather than high risk. And so I think taking everything into account obviously needs to again be done on a case-by-case basis, but if you can stay 2 meters away from somebody and it's practical and possible, it's probably better than 1 meter or 1.5 meters. If you can't and you're wearing a mask to mitigate the risk and your IBD is well controlled and you're just stable on azathioprine, it's probably okay. But as Richard said, we're dealing in to a certain extent with some uncertainties that we can't give precise factual answers. It is to a large extent we're basing our answers on the best available evidence, which doesn't necessarily give everything. So yeah, just to summarize, I think that would be, if you can stay 2 meters away, probably better, not definitely. If you can't, mitigate as much as you can, probably mitigate anyway if you're 2 meters away. And you're sort of in historically what we would have described as a moderate risk group. But again, that's not necessarily based on anything other than our best guesses.
So I might just cut to the chase for Lucy and say I don't think he should be treated any different to any other child in his school.
Yeah.
And I think the fact he's on azathioprine does not put him at a significantly different risk, and the school should treat him as they would any other child in his school. So he should not be singled out to be further away from other children than other children in his class or his year group. So the school should just treat him the same as everybody else with good precautions all round, but he should definitely not be singled out. So I think, as we say, these are difficult decisions, but practically the message, just to repeat what we've said before, for children with inflammatory bowel disease now, they should feel comfortable going back to school, and they should be taking the same precautions as everybody else, but not higher precautions. I understand, and thanks Lucy for the question, that having any chronic disease like IBD brings its own worries and anxieties with it, and I think that on top of a long school absence and the worries about coronavirus have made the situation very difficult. I think everybody is taking things a stage at a time, and I think for our patients with inflammatory bowel disease, they should take things in small stages and grow confidence as they go back to school. We had an excellent session on psychology and IBD on the Catherine McEwan Live before, and I would refer anybody back to that session just for the links which are there, which give really good practical advice about situations where you're feeling worried or anxious about a new situation, and certainly going back to school with coronavirus and IBD is one of those situations. So there are very good practical steps on that session. So please refer back to it. Lots of good practical advice there. So we have a question now from Sarah Payne. So thank you for your question. I'm just confused how my son has to have the flu injection due to being on azathioprine, but he's able to return to secondary school with over 1,300 children without any protection against COVID-19 other than what schools have been advised to do. We're a little anxious about this, and he's very anxious more so. So I think anything you want to add, it's a very understandable concern, and I think we both talked a little bit to that. James, anything you want to add?
I think that the concern, I can completely understand that, and beyond what we've discussed already, I think just to reiterate, the risk to children of COVID-19 from all the available studies is low. The risk to children with inflammatory bowel disease, the risk of COVID-19 to children with inflammatory bowel disease, when they've been on azathioprine, so that last slide that I showed, is still very low. More than 90% of children who got inflammatory bowel disease, who got COVID, didn't even need to go to hospital. And beyond that, I can sort of from a flu point of view, when there's a vaccine for COVID-19, I'm sure we will be recommending it to everyone. But I think that beyond reassuring as we have, I think that we've got to sort of weigh the risks to the benefits and the risks of or the detriment of not going to school for a long period of time for children of all ages is potentially huge. And I think by sort of pushing this problem further into the future, it's not necessarily going to make it any easier when that time to make that decision comes. And we're in a position now, I think in Scotland you're in a better position than we are in England, but where that decision, I think the risks or the benefits now outweigh the risks, definitely. And we would encourage people to go back to school.
Okay, thanks. Amelia, do you get your flu vaccine every year?
Well, I was recommended to, I think people with IBDR, and then I think it was 2 years ago I didn't get it, and then I did get the flu, and I couldn't get out of bed for 2 weeks, and then because just of all the symptoms, then I wasn't really eating, which then just made my anxiety worse, because then my brain just goes in a cycle and I think I'm going to get ill, I'm going to have to go to hospital. So the year after, I made very sure to get the flu jab so that didn't happen again. So I would recommend, if you're told to get it.
Yeah. So I think especially this year, because of the coronavirus being around, it is important to try and reduce risk of getting other flu type symptoms. So just to remind people, if you are on steroids or biologics or azathioprine or mercaptopurine or methotrexate, don't get the live version, so don't get the one that goes in your nose. You need to get the other version of it. So just a little reminder there for everybody. Okay, James, you're doing a great job on these questions. You have another interesting question now from Kirsty. Kirsty, this is a great question, and it brings up another point for us. So, hi, I'm a teacher in a primary school and mum to a young child with Crohn's. I've seen my own children from my own class and many other classes in the school come down with what seem to be common colds. If it's this easy to spread the common cold with stringent hygiene measures in place, should we be more concerned about the spread of COVID-19 in primary schools?
Yes, it's a very good question. So I think the first thing to say is that the most common colds are not, so there's a number of different coronaviruses, of which COVID-19 is one of them. And the vast majority of common colds are not caused by coronaviruses. They're mostly caused by rhinoviruses, adenovirus, and a few others. And the ability of children to transmit those rhinoviruses mainly and adenovirus to each other is far, far higher than it is to transmit coronaviruses to each other. And I don't know why. We don't know why, but that does to appear to be the case, and loads of studies have backed that up. I think that it brings another very interesting point, is that especially in primary schools, I mean, telling children to social distance when they're 4, 5, 6 is, I mean, it's impossible to a large extent. I think that's very wishful thinking at the best of times, and so mitigating risk becomes a different conversation in primary schools in comparison to secondary schools. But the reassuring things are that the risk appears to be even lower for children when they're younger. So I think then you sort of starting to think about all the risks potentially to the staff, and you can probably, to a certain extent, mitigate the risks by wearing masks, good hand hygiene if you're staff. But if you're a primary school teacher, I've got a few friends who are primary school teachers, especially when in the younger years, their children will be, I don't know, have no respect for their social boundaries at the best of times, let alone if they haven't seen them for a long time. So it's very difficult to mitigate the risk completely, but I guess it comes back to that point that we've been making a few times, where you weigh the risks to the benefits, and we think that we do think that now that the benefits outweigh the risks. I don't have unfortunately a magic way of making 4-year-olds stay apart from each other, but I think that the risks are certainly much, much smaller in that age group.
Yeah. I mean, these are real and difficult decisions. I think what we can say from the things we know now is that while children can spread things like, the flu, the typical flu, very easily, and they are the people who will spread it to, older adults, this does not so far seem to be the case for coronavirus, in as much as we know just now. So they will catch other types of viruses. All viruses are not the same. So they will catch other viruses in a slightly different way to the way they catch and spread coronavirus. And their overall risk is very, very low. But I absolutely sympathise with your concern. And in a class full of snotty P1s and P2s, I can absolutely see your concern. I think the science suggests for now that it's relatively safe, but we have seen, this week and last week, some cases break out in primary schools too. So I think you can only continue to do your best there. Thanks, Jenny Cook, for your kind comments, a regular viewer of the live session. I think this next question, I'm not sure I know the answer to it in terms of an absolute answer. But I'll ask you, James. I think we can say we don't know the answer to this one. So it's a very practical question about the effectiveness of hand gels. So I think we've all been using them, and I think the rougher ones are bad for our they're bad for our skin, And the first couple of weeks I was using them, my hands were red raw, and I seemed to get a bit of eczema and everything. But Dorothy has asked us the question: what are the differences in effectiveness of no alcohol and hand gel, kinder to the hands, and alcohol-based hand gel? I mean, I think the alcohol gels are more effective, but I can't say how much more effective. I'm not sure if either of you know, Amelia or James.
I would agree, but I think it's very anecdotal that the alcohol ones, they smell like they're doing more, but I don't know. I can't point to any evidence to suggest that is the case. But I mean, we've used alcohol hand gels in hospitals for many, many, many years, and I think that would probably point to them being effective against viruses and bacteria. But yeah, I think that they do definitely have an effect on your skin on your hands. So again, I don't think there's an easy answer, unfortunately.
Yeah, Dorothy, we don't know the precise answer. Amelia, you got anything to say about that?
Don't think so. I think as well though, like if it's just going to the shops or something and coming back, they've said like washing your hands is just as efficient. So if it's like an option to wash your hands, I think that would be less harmful for your skin.
Yeah, and I think the main message is, particularly as we're talking about school, is to make sure you know, when you're in school, you clean your hands regularly, particularly before food, and then you make sure before you're going into school, and especially when you come back in from school, then good hand hygiene is there. I think we're coming to the end of our questions shortly, so I would encourage anybody with any last questions to bring them in. I would encourage people also to let us know what they want us to feature in future Facebook Live sessions. So if you have any ideas, I think we've covered a broad range of topics over the past few months supported by the foundation, but if there are any things that you think are particularly need to be covered, then please let us know. James, do you have any final thoughts or messages for everybody who's been watching tonight?
So one other thing that I think would be worth mentioning is that in schools, having and it's been again in the news quite a bit, having a good track and trace system is really important. So I think we've got to have a certain amount of confidence that if there is a child or a young person who tests positive for coronavirus, that there is a good system in place to be able to mitigate, to close down the risk associated with that. And I think you guys have got you've got a better system in Scotland than we've got in England. But I think that overall there needs to be some confidence that we can mitigate the risk a bit further through an effective track and trace. I think yours isn't called track and trace, is it? It's called something slightly different. But a system where you identify a case and then make the case contacts of that case isolate until we're sure that we can't spread it anymore. So I think that's probably the only other thing to say.
Brilliant, thank you very much. Amelia, you've been fantastic tonight, groundbreaking in being our first patient to feature on one of these sessions, and you've kept me and James in track, I think. Anything you want to say before we close up?
I don't think so. I think from what you just said about how important hand hygiene is, it's weird because in my school I saw soap in the toilets for the first time a week before lockdown. Like, it's crazy. Like, they'd never had soap or anything. So now when you go in any class or walk down any corridor, there's hand sanitizer everywhere. So you're sanitising your hands every few minutes, from going to having no soap at all to doing that. It's really weird.
Okay, so on that positive note about improved cleanliness all over, I'd like to thank James and Amelia again tonight for taking part in this session. Please share the page, let us know what you'd like in future sessions, and please take care of yourself and everybody else. Bye for now. Thank you very much.
Bye.